We had tremendous success in 2022 in promoting the specialty. For the 30 years that I've been practicing as a physiatrist, it's been astounding to me that physiatry and PM&R has been the best kept secret in medicine. Nobody wants it to be a best kept secret anymore. We want people to know what we do. And the work that we did with our PASC, our post-acute sequelae of COVID, and our collaborative, we published guidance statements, and we were on the news on a regular basis promoting the work that physiatrists do in leading this effort, producing these guidance statements. I can tell you that we had 90 plus appearances in major national and healthcare media outlets, and I'm talking the big league. This is not like my Boonton Township News, right? I'm talking ABC News, WebMD, Politico, Axios, Consumer Reports, MedPage Today, Wall Street Journal, Medscape, many, many more. So the awareness of what we did for PASC is really well known. And I can tell you to this day, I'm still getting myself interview requests on major media. But it's not just that we were able to promote what we are doing for PASC. It's just the value defining to the public and to healthcare officials and to the C-suite. This is what physiatry is. It's not just, PTOT, eval, and treat. Value that we add to medicine, to patient care. We were tremendously successful in doing that, and we continue to do that. So we are no longer the best kept secret in medicine, and there's more to do and more to come in 2023 and beyond.
Besides supporting AAPM&R through membership dues, what can members do to help advance this future of our specialty, and particularly for like young physiatrists like myself?
That, again, a great question. First of all, I'm going to say that there are lots of medical societies that physiatrists can join, and we are a diverse field. And I think that's one of our greatest strengths. It's also a bit of one of our challenges, right? We have CNS specialists, we have pain specialists, we have musculoskeletal specialists, pediatric specialists, oncological rehabilitation specialists, geriatric specialists, wound care specialists. The list goes on and on and on. But at the end of the day, we're all physiatrists. And the academy is the primary medical specialty for physiatry. And we are an organization of physiatrists for physiatrists. And I think it's perfectly good for members or physiatrists to belong to more niche-like specialties or specialty societies, sports related, CNS related, brain injury related, pediatric related. And I think that that's good, fine, and actually helpful. But there's no organization that is going to advance your work as a physiatrist or a physiatrist or a rehab doc like the AAPM&R, because we are a organization of physiatrists for physiatrists, and we will always have your back. And that list of things that I talked to you before in your first question really outlines that. But I will say this. There are lots of opportunities to volunteer for the Academy. I have been a volunteer for almost the entire 30 years I've been a practicing physiatrist. Hard to imagine. I had hair when I first started. I didn't lose it because I volunteered for the Academy, so don't worry. But but I will say it has been a tremendously professionally and personally rewarding experience contributing and volunteering for the AAPM&R, because I know that the work they do is supporting the work I do as a practicing physiatrist, as an administrator, as a researcher, as an educator, and they really are advancing the field. Lots of opportunities to volunteer, and when you volunteer, don't be afraid to speak up and to share your ideas and your thoughts. That's what we are looking for. So sign up, be a member of one of the member communities. It's very easy to in many of those communities to rise up and be noticed. And when you get noticed and you're one of those people who are reliable and you get the job done, man, you just advance. So lots of opportunities. So being a member, exceptionally important, even if you don't volunteer. But when you do, you're helping yourself, you're helping the field, And it is just so rewarding to know that you're doing something to help you, yourself, your colleagues, the field in general, and let's remember the patients that we treat. So sign up, volunteer, lots of opportunities. We will thank you, and it'll just be a great experience.
Awesome. Well, thank you so much. I mean, yeah, I have to say my time on the Fit Board has been some of the most rewarding things, time that I've ever really spent in my professional career so far.